Thank you, and good morning to all of our panelists. Dr. Abubakar, thank you so much for speaking up, and I also want to thank Senator Isaacson for talking about his grandson. I was governor of New Hampshire before I took on this role, and so I've been dealing with the opioid epidemic in my home state, where it is absolutely devastating, since 2013. And I have to start by saying that if this were any other kind of public health crisis, that we're taking 100 lives a day, which is about what the opioid overdose death rate is right now. If this many people were dying in a defective plane every day in the United States of America, we would be devoting considerably more resources to it. And part of the reason we haven't is because of the stigma that has traditionally come with addiction. So, Doctor, you're speaking up about your son, Senator Isaacson speaking up about his grandson. The people in this room, and I know there are many who have lost loved ones or who have struggled with addiction themselves, speaking up about it is critical to this. We need a long-term strategy to solve this complex problem, and that requires funding to support those on the front line of the crisis. The Trump administration has so far refused to request additional funding to fight this crisis. And yesterday, I pressed the HHS Secretary nominee on the issue because we need the administration to send to Congress a supplemental funding request so that we can appropriate more funds and resources. So for each witness here, I just would like a yes or no answer. Do you think additional funding is necessary? And I'll start, Doctor, with you and just go down the line.
Yes.
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 Additional, and I apologize, I had to ask,
No,
I had a question to clarify something. The question, additional funding for addiction treatment. I'm sorry, I
Treatment,
apologize.
prevention, recovery, but do we need more funding on the front lines?
Yes.
Thank you. To Director Magermans, I want to thank you for your leadership in helping us understand how PDMPs are really critical to combating this epidemic. And I just wanted to drill down a little bit. While states can benefit greatly from these electronic databases, there continues to be some difficulty in ease of use and accessibility. PDMPs are only informative if prescribers actually utilize them. Do you believe that integrating PDMPs into electronic health records will promote better workflow for providers and increase the likelihood that they would use PDMPs?
The short answer there is absolutely yes.
Okay. Do you think substance use counselors and mental health providers who often work with patients experiencing substance misuse disorders on a longer-term basis should have access to PDMP data as well?
In Wisconsin, substance abuse counselors licensed by the Department of Safety and Professional Services can access the PDMP, and the feedback that we have received from them is that it is a very valuable tool. And we have other social workers with a specialty in substance abuse disorder treatment who access it as well, and they also say that it is a very valuable tool. So I would say that yes.
Okay, thank you. To Secretary Tilley, I appreciated your testimony about the coordination between law enforcement and public health officials in Kentucky. We know that this is an epidemic that knows no bureaucratic boundaries, and we need to ensure that we are breaking down the silos between different agencies and officials, silos that can prevent us from responding appropriately to the epidemic. Something I focused on when I was governor, and in New Hampshire, we're doing some really interesting work. It's called Safe Stations. Through that initiative, firefighters are available 24/7 at participating stations to help connect individuals in need for treatment or recovery services so that people struggling with addiction know about the resources available to support them on the road to recovery, and so that firefighters can help with what we call a warm handoff to peer support or treatment. I am very proud of our brave firefighters for all they do to strengthen public safety and public health, including really driving this important initiative. Could you talk a little bit more about the importance of ensuring that public safety officials are helping us address these public health issues, and whether you think programs like Safe Stations can help us turn the tide?
Absolutely. First responders are critical in this because they're the boots on the ground, first to respond. Again, things like needle exchange programs make it 5 times more likely. They touch the people on the ground where they are. The harm reduction model, find them, get them into treatment. That's part of the untold story there. LEAD is being announced in Louisville, law enforcement assisted diversion, to get those mentally ill and addicted into treatment rather than a prison cell or a jail cell. That's very critical. And again, our governor having a very connection to New Hampshire, we know about safe stations, and that is a great program. We need to do more of that. I also cannot go without mentioning our Angel Initiative. We have a very dynamic state police commissioner that's spent a lifetime at the DEA,
Yep.
and he understands the need to do this. So that's why we've made such tremendous progress in a very short period of time. Again, the Angel Initiative is anyone can come in with paraphernalia, addicted, throw down that in a police station setting, and be connected to treatment that same day. We guarantee that treatment bed the same day. No criminalization of any conduct.
Thank you very much. Thank you, Mr. Chair.